Topic is Finochietto Retractor. Hello students, we'll discuss an instrument which is often used in cardiothoracic general surgery, laparotomies, GS surgery. Just see what is this instrument is. See that there is a levering action system. There is a stout blades. Two blades are very stout, which can retract. What is this instrument? It's a Finochietto self-retaining retractor, often called as lift share rib retractor, and it retracts the rib when cardiothoracic surgery adequately so that deeper plane you can do a proper surgery, any lung surgeries, esophageal surgeries, individual thoracotomy. It's also useful in many renal surgeries, wide area to retract big major laparotomies because it's a very stout instrument. It is self-retaining retractor and blades are very stout, and levering action makes you to retract quite easily without much difficulty. Don't get slipped out. So it will be very stable, stable manual, self-retaining, not manual, stable self-retaining retractor. So that's why assistant's hands will be free, who can help the dissection, and the deep dissection, visibility of the deep areas will be very, very adequate and good for surgeon to do dissection and proceed to the proper surgical technique, dissection, tissue approximation, whatever thing is required in the deeper plane. That is why this is very useful. Finochietto retractor for cardiothoracic, other surgeries also it is used, and you can always go through my clinical method surgery and manual of surgery for the instrument chapters and see that here retractor how it is kept here. See the blades are widened here. So this is just photo here. See the instrument here, levering action. You can see that how blades are there. So very, very useful. So this is about the Finochietto. He was a surgeon from Argentina, and he had invented a lot of things. Around 67 inventors in credit. Finochietto, Caesar, stretcher. We had designed OT room, OP room, outpatient room concept as he has brought, dressing room, surgical table, vacuum device surgery. So many things. He is a renowned EA surgeon and cardiac surgeon of that time actually. So that is about Finochietto. Very useful instrument you might have seen in many major surgeries, not in a day-to-day regular hernia, appendicectomy. In such surgeries it is not used. Major surgery it is quite useful. You can always go to the OT and see this instrument. Very good, beautiful strout, deep retractor. It holds very well without getting slipped easily. So very useful instrument, Finochietto retractor. Look at that, how exactly it looks like. Answer, identify this instrument. So students, please go through these MCQs and I'll acknowledge, put the right answer in the comment box. I'll put the right answer. I'll acknowledge your answer. And also again, please subscribe my YouTube channel, share with your friends and colleagues, and daily watch my 5 to 10 minutes lectures daily. It will upgrade your surgical knowledge, and with the MCQs, try to answer the MCQs with a beautiful quotation in the end. And so again, requesting subscribe my YouTube channel to upgrade your daily knowledge. And also there is a live session once in regular interval, 2 weeks or week, wherein student will present, and other than me, senior professors also will be there. So we'll have a lot of interactive session. We can discuss within the chat box, and also we go how to mainly clinical examination, practical point. 1.5 hours live sessions will be there. Very, very useful for a practical examination. And if you join live session, get a certificate will be very, very useful for your future career as such. Put the right answer. Identify this instrument A, B, C, D. Put the right answer in the comment box. I'll get back to you later. Again, and the second instrument, Igli saw, guide wire, Dormia basket, breaks the detail, and again I'll put the right answer in the comment box. And quotation of the day is, no one has traveled the road of success without crossing the streets of failure. So it is not that difficult, it's not that easy. Initially, we will have a failure. There's got streets of failure. Then we will have a road of success. So to get a proper road, you have to go initially small road, then enter the main road, then enter the highway, like that. So it's difficult. It's not straight away you go to a success. You need to struggle. You should have a lot of hurdles. That's what exactly, especially in surgical field. It is very, very useful, this quotation. So again, request to please subscribe my YouTube channel and join live sessions. Students, I hope you have understood this lecture very well. Thank you so much.